Good afternoon, everyone. Welcome to the session on the introduction to the 2024 NIH Public Access Policy. My name is Yinting Zhang, and I am the Research Services Librarian at the Health Sciences Libraries stationed at the RWJ Library of Health Sciences in New Brunswick. In this session, I'm going to provide you with a basic understanding of the new policy and how it is different from the 2008 policy. What are the key requirements and how to comply with the new policy? The slide presentation is being recorded, but the Q&A section will not be recorded. The recording will be made available at the University Library's NIH Public Access Policy Research Guide. I will drop the links later. If you have any questions, please put them in the chat box and I will address them after the slide presentation. But right after the slide presentation, I do want to go through a few websites and I wanted those to be recorded. So then afterwards, we'll address the questions, okay? I hope by the end of the session, you will be able to have a better understanding of the new policy and understand what are the major requirements and know how to comply with the new policy, identify the useful resources related to the policy, and also to utilize the useful tools for managing compliance with the policy. And then Q&A. So what is the NIH Public Access Policy? NIH actually has long supported the public access to its funded research outputs. Its public access policy has been implemented ever since 2008 to make the final peer-reviewed journal manuscripts arising from NIH-funded research accessible to the public. NIH PAP, Public Access Policy, is a term and a condition for all grants and contracts that are awarded after April 7th, 2008. So it is a law and it's mandatory to comply. NIH-funded researchers must submit their Author Accepted Manuscript to PubMed Central upon acceptance for publication and making the applicable papers publicly available under the 2008 policy, make it available within with a 12-month embargo. However, with the new policy, the paper will be made publicly available on the official date of publication. Why is the policy important? And this is to ensure that the public has access to the published results of NIH-funded research. And the policy aims to accelerate research and generate higher quality scientific results, encourage great scientific integrity, and enable future inquiry, discovery, and translation for NIH-supported research. So on the whole, it is to advance science and to improve human health. The current policy, which we really have only 3 days to go, the current policy is the 2008 version. It was implemented in 2008 for all grants and contracts. And the original public access policy is still in effect until June 30th this year, so in 3 more days. And many of you have been already aware or been very familiar with the current policy, which allows a 12-month embargo for the final peer-reviewed manuscript to be made available in PubMed Central. This is important to comply because the failure to comply with the policy could result in delay of processing or discontinuation of the award. In August 2022, the Office of Science and Technology Policy, or OSTP, released a memorandum on public access to federally funded research. This memo is often regarded as the Nelson Memo, This memo outlines new requirements that will affect the federally funded researchers. The memo is to provide a free, immediate, that means without the embargo, and equitable access to research that is federally funded. It applies to all research agencies, including those providing funding in the humanities and social sciences. It applies to both peer-reviewed publications and the underlying scientific data. In responding to this memo, NIH implemented the NIH Data Management and the Sharing Policy, which is already in effect, and updated the NIH Public Access Policy. The new policy was issued on December 17th, 2024. It was originally scheduled to launch the new policy on December 31st, 2025. However, on April 30th, the new NIH director announced that the policy will be enforced on July 1st. It moved forward the implementation date to July 1st, 2025. And that leaves us very little time to prepare. That's why it's so important to get familiar with the new policy. It will affect you. The new policy now, the 2024 NIH PAP, which will be effective on July 1st this year. So any author-accepted manuscripts resulting from NIH-funded research for publication in a journal will be subject to the 2024 NIH PAP, which requires the applicable paper to be deposited in PubMed Central upon acceptance. Remember, acceptance for publication, and be made publicly accessible in PMC immediately on the official date of publication. Also important to remember that the funding date or the submission date does not impact the applicability of the policy. It is the acceptance date that impacts the applicability of the policy. That is, the policy only applies to articles accepted for publication on or after July 1st, 2025. The policy, according to the NIH Public Access Policy, FAQ, the policy applies regardless of whether the NIH-funded principal investigator or the project director is an author or not, and regardless of whether non-NIH funds contributed to developing or writing the author-accepted manuscript. The policy also applies regardless of NIH funding mechanism. Author-accepted manuscripts reporting on projects that may not be considered research are within scope. The policy does not apply to book chapters, dissertations, preprints, or other interim research projects that are not peer-reviewed or accepted for publication in a journal. In addition, the policy does not apply to peer-reviewed manuscripts resulting from research that is not the result of NIH funding, including peer-reviewed manuscripts resulting from research that only use NIH data or resources or infrastructure generated to support. So make sure this information is available from the very newly updated frequently asked questions page. So also be aware that there is no cost for compliance. NIH does not require authors to publish in open access journals for compliance. Do not pay for OA publishing purely for compliance. Remember, it is not an open access mandate, but a public access policy. Publishing with journals that do not make their content immediately publicly available is allowed, as long as the author-accepted manuscript is submitted to PMC upon acceptance for public availability without embargo upon the official date of publication. So the major requirements under this new policy is, first, you need to understand that as an NIH-funded researcher, you grant NIH the rights to the accepted manuscripts that are equivalent to those of the federal purpose license, which is also known as the right to deposit. And it's a royalty-free, non-exclusive license that allows federal agencies to reproduce, publish, and otherwise use work funded by federal grants for federal purposes. So that's the right to deposit. When preparing your manuscript for submission, and before submitting your paper to a journal, before you sign a publication agreement or similar copyright transfer agreement, you must confirm that the publisher's policies allow you to post the paper in PMC in accordance with the NIH Public Access Policy. It is critical to inform the journal that the manuscript accepted for publication on or after July 1st, 2025 are subject to zero embargo. That is, the full text must be made available in PubMed Central immediately upon the official date of publication. It is also important to include the NIH rights statement in manuscripts submitted for peer review. This can be included with the grants acknowledgement section. The NIH rights statement informs publishers and the journals that the work is subjected to NIH PAP, and that NIH, as the funding agency, has the right to make it the Author Accepted Manuscript, or AAM, publicly available in PubMed Central. So a sample NIH rights statement can read like this. This manuscript is the result of funding in whole or in part by the National Institutes of Health. It is subject to the NIH Public Access Policy through acceptance of this federal funding. NIH has been given a right to make the manuscript publicly available in PubMed Central upon the official date of publication as defined by NIH. So this statement can be included. For researchers, as I have mentioned earlier here are some important questions that researchers should ask themselves in preparation for complying with the policy. So, does your accepted manuscript arise from NIH-funded research? If yes, are you aware that it must be deposited in PubMed Central upon acceptance for publication and make available on the official date of publication? So remember, these are two different dates. So if your paper is applicable, is subjected to the policy, then as soon as you get the acceptance notice, you should start depositing in the NIMS through the NIMS system. I explain later in more detail. So another question you think about is, did you include the NIH rights statement in your manuscript when submitting to a journal? Does the journal you are submitting the manuscript to happen to be an open access journal? If yes, does the Rutgers University Libraries have a transformative agreement with the journal or the publisher to cover your article processing charge, APC? If not, does the journal or publisher permit no embargo deposit? So if there are no transformative agreements between the journal and Rutgers for open access publishing, have you budgeted for article processing charge before submitting to an OA journal? Remember, you are not required to publish in OA only, just for compliance. As long as you have the article manuscript AAM to be deposited, you are in compliance. So it doesn't mean you have to publish in OA. So that is something that you should be aware. for depositing the AAM, the Author Accepted Manuscript, who will submit the manuscript to PubMed Central via the NIM system, the NIH manuscript submission system? If you delegate somebody else to do it for you, do you remember that you have to approve twice? If you don't respond, then it will be staying there without being processed. If you have a research admin to assist you, have you added that person as your delegate to manage compliance for you? So all these things you need to remember, keep in mind. Here's a screen capture of NIH Public Access website. It's a stay with the data sharing policy website. Currently, see that the brown part was just put out late on Wednesday, right when I was presenting to the RAIN group. Then they updated the website, because in the morning I checked, it was still not updated. So the website states clearly that right now the website still has the information for the 2008 policy. So don't follow that. Right now, the 3 days still using this policy, 2008. On July 1st, the website will be flipped to the new one. But during this period, you can read the FAQs for more detailed information on the new policy, or attending session like this one to learn about it. So compliance with the policy is not, remember that, compliance with the policy is not the responsibility of the publisher or the journal. It's really up to the PI or the PD and the institution that is responsible. So this is very important to know that. When multiple NIH-funded investigators author an AAM, the author accepted a manuscript, the AAM only needs to be submitted once to PubMed Central in accordance with the policy. When the work resulting in an author-accepted manuscript is funded by multiple NIH funding sources, then the multiple NIH award numbers can be linked to the submission on July 1. And then, so read the website for more information. I assume more information will be added very soon. In compliance, those of you who are familiar with the 2008 policy, there are 4 methods to use to comply. Basically, method A and method B for final published articles, and then the C and D, the manuscripts. So there are 2 kinds of versions of the paper that we need to, NIM only requires the AAM, the author accepted manuscript. What is that? It's authors accepted the manuscript of peer-reviewed paper, accepted for journal publication, also known as the postprint. It includes all the modifications from the peer reviewers and submitted by the author or designee to PMC using the NIM system. Now, if your paper is published in open access journals, and those journals, some of them have an agreement with NLM, National Library of Medicine, some of them you have to make a special arrangements, then those are the final published article that are deposited by the journal or the publisher directly in PubMed Central. So what is that version? That version means journal's authoritative copy of the paper. Sometimes if it's in OA published, then you own the copyright, but the journals will agree to put in PubMed Central. So that version includes all modifications from peer review process and publishing process, including copy editing, stylistic edits, formatting changes, etc. And it's usually submitted by journals and publishers to PMC, and authors do not have to do anything about it. So let's look at this one. Journals with active agreements to deposit all articles can be found in the PubMed Central journal list, which is available at this link. NIH recommends reviewing the specific journal record to confirm that the release delay is 0 months, means 0 embargo, immediate release, and the agreement status is active. So this is actually very similar to the method A in the 2008 one, although it doesn't mention at all. Now, also a journal or publisher may also deposit the selected articles in PMC if you make a special arrangements and to follow for immediate release. So a list of publishers that provide this service is available on the link. So you can refer to this slide for these links. And be aware that the availability of the final published article on the journal or the publisher's website is not a proof of compliance. It's not sufficient for compliance with the policy. To be compliant, the author accepted manuscript or the final published article must be submitted to PMC for public availability without embargo upon the official date of publication. The public availability of final published article on journal publisher websites alone is not sufficient for compliance. Compliance can be achieved through one of the ways, the two ways. You either submit the electronic version of the author accepted manuscript to PubMed Central upon acceptance for publication, for public availability without embargo upon the official date of publication. I feel like I'm repeating this over and over again. Another way is submit the final published article to PMC from journal or publisher with formal agreements with National Library of Medicine upon the official date of publication for public availability without embargo. So without embargo is the key. If the journal submits the final published paper for you, then you don't have to do anything. However, if the journal or publisher does not deposit the final published paper for you, then you or your delegate must submit the AAM, the Author Accepted Manuscript, to PubMed Central via the NIM system, the NIH Manuscript Submission System. The PI, regardless of who submits, must approve twice. First, the submitted manuscript, then the formatted version to complete the deposit process in PubMed Central. Remember, the approval happens twice, okay? That's important because in the past, the PIs didn't realize that it's waiting for the person to approve. And then if no action is taken, this whole process is delayed, and that can cause incompliance. So it is the PI, again, I mentioned again, it is the PI or the PD and the institution who is responsible for compliance, not the journal, not the publisher. This is a screenshot of the NIMS submission system. So you can start new manuscript by clicking the button, the blue button. And I mentioned that it's important to approve twice. So this is the flow chart of the submission process in the NIM system. So the two approval is one, the initial approval, the reviewer associates funding and approve the material for processing. The second approval is, so NIH received the submission, started to process and formatting. So at this point, the submitter has to, the PI usually, the PI or PD usually will approve again to make sure the formatted version is correct. And then the PMC ID is assigned, and that is the proof, that's the evidence of compliance, the PMC ID. I will talk about the PMC ID later. So to show that you are in compliance, when you apply for grants, when you file RPPR, progress reports, If you are citing any resources that you have and then funded by NIH, you need to cite the reference with the PMCID. Otherwise, you're not in compliance. So the PMCID is listed, like I'm showing as an example in red. It's not the same as the PMID. They are different. So this is to show you the differences between PMID and the PMCID. The PMID is the unique identifier assigned to each citation that is added to PubMed, the database. It is distinctly different from the PMCID. The PMCID is a unique reference number or identifier that is assigned to every full text article that is accepted into PubMed Central. PubMed Central is a repository, not the bibliographic database like PubMed is. You still use, as in the past, you still use My Bibliography as a tool to manage compliance. So whenever you see a red label, that means you're not in compliance. You need to check whether this is funded by NIH. If not, then just say not applicable. Usually the award will just popping up and then you connect them. And to connect them, you actually start submit the AAM into NIM system. That's how you start. And one time, and there was a research admin asked me like why this one is not like in compliance with what you do. I look at it, it's actually a book chapter. It's not applicable. This book chapter is not subject to the policy. So you just say not applicable and then it's resolved. So whenever it's resolved, if it's gray, that means you already take care of this. This is not applicable. When it's green, that means this is already in compliance. It's the red one that you have to take care of. Otherwise, that delay your application or progress report or delay even discontinuation of your award. So adding a delegate in NCBI is important if you are lucky enough, if you happen to have somebody else to help you, but not all researchers have that resource. So if you have a research admin or research assistant to help you, make sure you add that person as a delegate in your NCBI or EIA Commons, wherever. Then you give permission to My Bibliography to help with compliance. And here are a lot of links that I put it here for you to refer back to. So the NIH Public Access Policy page, I will probably drop them in the chat so that you can have them. So here is the end. If you have any questions regarding NIH Public Access Policy, you can refer to the research guide. You can contact my colleagues, Rhonda Marker, my boss, Tony Gwen, and also Victoria Wagner. And I will be on sabbatical leave for the next half year.